Hi, my name is Dr. Iraj Kasimi, calling from Hillcrest Dental. I'm going to go over a few questions about dental checkups. Having regular dental checkups is very important in order for us to be able to keep you at tip-top health. There's a lot of problems that we can take care of when they're very, very small, a lot less costly, a lot less time consuming to be addressed earlier on, rather than waiting for them to get larger, and it's going to become a much more invasive and involved, situation if things are not taken care of earlier on. We also can take care of your cleanings on a regular basis in order to prevent you from developing gum disease, which can lead to much more severe dental and medical problems later on. So we highly recommend getting a dental checkup every 6 months. It's very important to see you every 6 months because things can change a lot in 6 months. And sometimes we even recommend seeing patients sooner than that for their dental checkups. But every 6 months is the default schedule for your checkups. Yes, dental checkups can definitely prevent oral health issues. We utilize the latest technology in terms of getting your x-rays with the very least amount of radiation due to our digital x-rays, and we use AI software to help us make sure we don't miss anything and help you be able to see what we're seeing in addition to your photos. And then having the doctor look at you in person is very, very important. There are certain things that we may not be aware of. You may not be having any sensitivity or pain, but are still infections or cavities that are brewing that need to be addressed before they turn into bigger issues, in addition to your regular cleanings. So yes, they can definitely prevent. So as far as what's included in a dental checkup at Hillcrest Dental, you're going to be coming in treated by a friendly team up front who will check you in. We have a very friendly dental assistant who will bring you right back. We typically only get a few bite wing x-rays every 6 months. And then we'll bring you back in. Sometimes we'll do that once a year, bring you back in. The hygienist will take a look at you. They'll measure your gums and take a look at how your gum health is doing. We usually do that measurement once a year, and then they will go ahead and clean your teeth. They'll take some pictures of your teeth as well, and the doctor will come in, look at your mouth, go over the photos with you, and see if there's anything there that needs to be addressed. We take a look at your gums and teeth. We take a look at your bite and how your occlusion, we call it, is in terms of the positioning of your teeth and if there's any damage being done to your teeth. We even do a screening for possible sleep apnea. So if you're having trouble sleeping or anything like that, grinding and other issues that can affect dramatically your overall health, we'll take a look at that as well. So during a dental checkup, our dentist will be looking for firstly, we'll do a head and neck exam and oral cancer screening, which is very important to have done regularly. If there's any lumps or bumps that are unexpected in your head or neck region, any lesions inside of your mouth that we're seeing or in your face, we will be looking for all of those things. We'll be looking at your teeth to make sure there's no, first of all, attrition, wear and tear, damage, signs of any possible acid reflux, things like that. We'll be looking for cavities, of course. We'll be looking for gum disease, making sure your gum health is good and strong, looking at your bite, and just how you're feeling about your smile. Are you confident with your smile? How they look? Do you want to make changes? Do you want to enhance the appearance of your smile? Do you want to do whitening or possible cosmetic options? So we look at everything, a completely holistic view of how everything's looking. We also have a very high-tech and very modern CBCT x-ray machine where we can take a 3D view of everything. If it's needed, we'll get one of those. And that way we can detect any disease or any other problems that might be going on in a 3D manner, and we can go over that with you as well. So a dental checkup, it's typically scheduled at the same time as the cleanings. It's a 1-hour appointment. We should have you in and out within one hour typically. If there is treatment that's needed and the schedule allows for it, and you could stay a little bit longer and get that done, we work very hard to incorporate same-day dentistry when the schedule for the patient and for the doctor allows for that. But if it's just a cleaning and exam, it's about an hour. Dental checkup should not hurt at all. We have, like I said, we train our team to be very, very gentle throughout the entire process. We're going to be taking some pictures and some x-rays and taking a look. And we have some fabulous, gentle dental hygienists who will go in there and do your, cleanings and make sure you're, having a wonderful and pleasant experience throughout your visit. So we offer a few options to schedule your checkup. If you're a returning patient, you can schedule online. You can also text us at 702-395-1088, and one of our schedulers will be reaching out to you to schedule an appointment. You can also request an appointment on our website. And of course, you can call us anytime. We have a live receptionist available during our normal business hours at 702-395-1088. However, if you call us after hours, we have an AI receptionist currently that will be able to take care of most, functions. But if not, we'll definitely call you back or text you back right when we get back into the office. I hope I was able to answer any of your questions in regards to dental checkups. If you have any additional questions, or if you're wanting to come in for a dental checkup, please give us a call, 702-395-1088, or you can text us at that number. You can also visit us at hillcrestdental.lv.com.